thank all of you for joining us. We have a really great event for you today where we're going to learn more about nutrition and food security and some of the opportunities that you all have to make a difference in the public policy debate around those issues. So we were going to start off with our guest speaker, which is Representative Nicole Collier, but the representative is delayed right now. I'm talking to them over email, so I think we're going to go ahead and start with the first portion of our event and come back to the representative when she's able to join us. And so to introduce our first speaker, we're going to have Douglas Dunsavage, our Community Advocacy Director in North Texas. Take it away.
Thanks, Alec, excuse me. My name's Douglas Dunsavage. I was on the previous event, but I wanted to introduce myself again. I am the North Texas Community Advocacy Director. I've been with the American Heart Association for 18 years now. And I've worked in numerous roles, both nationally and statewide, and this community work that I'm doing in my current role now is probably the most rewarding, and I'm just so excited to have everybody participate in these great events over the course of these spring months. So appreciate everyone for being here. I want to introduce, I'm very excited actually to introduce our next speaker. She is actually my boss, and she is the Vice President of Health Strategies for North Texas, and her Jenny Iyer. And Jenny graduated with a BS in biochemistry, smarty, from Abilene Christian University and earned her MPH with a concentration in maternal and child health from the University of Texas School of Public Health. She's a native Texan. Jenny has spent her entire career focused on improving the lives of children and their families across the state, working to make Texas a great place to live, work, pray, and play. And I will turn it over to Jenny for her presentation. Thanks.
Thanks, Douglas. Good afternoon, everyone. I am thrilled to be able to be here with you all today, getting to talk about one of my favorite topics, something that I have been able to work in all across North Texas and the state of Texas, really, for the past nearly 10 years. So it's exciting, and I will say I'm really excited for the end of my presentation so that we can bring on Catherine Nicholson, who has been my partner in crime in this for several years, really trying to expand school meal access in local schools. So we will get started. I'm not going to let you get off without more trivia. So just thought we would ask a couple of questions to kind of set us up and get the conversation going. So thanks to Elizabeth for helping to put in poll questions. I am not that Zoom savvy, but we will fake it today. So the terms nutrition security and food insecurity have the same meaning. True or false? Normally when we do these, we have people stand up. So I know your camera's off, but if you want to stand up, stretch your legs if you think it's true, stay sitting if you think it's false. You can get some exercise too.
Okay, looks like most everyone has voted. All right,
Okay.
what's thought?
All right. Good job, everybody. It is false. So this is something that the American Heart Association has really helped me with because it's something that I use food insecurity a lot. But we at the AHA and what you'll hear today, we're really focused on that nutrition security piece. We don't want people to just have consistent access to food. Now, that is a first step. So we certainly want to have food security and for people to no longer be food insecure. But we also want people to have nutrition security. We want them to have access to healthy and nutritious foods all the time. We want them to be able to access it quickly and closely. There are so many neighborhoods and communities all across North Texas that do not have convenient access to healthy and nutritious foods. And so, it's just kind of a two-step piece. We want people to be food secure, but we want everyone to have that nutrition security piece. So that's what we're ultimately striving for, is that people have consistent access to healthy and nutritious foods at all times. So everybody did a great job. Good job on your first question. This one might be a little bit more tricky. So I will let Elizabeth bring that one up. How many children in Tarrant County qualify for a free or reduced meal? While y'all are thinking about this, I will put a caveat here. Because of COVID, these numbers are a little bit outdated. Like they are in reference to the last time we were able to pull this information. Due to COVID, students have not had to fill out a free or reduced form. And so, right now, everyone across Texas, across country, are able to take advantage of free and they are able to get a free meal at school, which has been incredibly beneficial for a variety of reasons. I'll talk about that in a little bit, but just so that you know, in Tarrant County, what we're looking at when we talk children who are who are filled out a form and are qualified either because they turned in a free reduced form or because of other qualifying ways to be able to get a free or reduced meal during the school day or after school as well. Oh, Elizabeth, I haven't voted, sorry. If that's skewing it a little bit.
Let you cast your vote.
I voted.
All right, let's share the results.
Good job, everybody. Almost half of us got it right. 220,000 students qualified in Tarrant County for a free or reduced meal. Those meals mean so very, very much to the families that they serve. And something that we really try to look at, and what we're going to talk about a little bit today, is how we ensure that we are meeting kids where they are, because we recognize that there might be a lot of kids that don't actually qualify for a free or reduced meal, but could really benefit from it. They might be right on that line. And so we look at trying to get school meals universally served for free. So looking at universal school meal programs, community eligibility programs that are taking advantage of the resources that the USDA gives local school districts, that the Texas Department of Agriculture gives local school districts, to be able to serve meals for free to everyone. That enables school districts to capture those kids that wouldn't qualify for a free reduced meal, but it also allows for those students who wouldn't qualify to also participate, which brings down the stigma of taking advantage of those meals. It brings it down by a ton. So no longer is it just kids who don't have food at home, but it's anybody and everybody can participate. Makes it more fun, and we see higher participation levels when we see schools taking advantage of those programs. All right, next slide, Elizabeth. So when we talk about nutrition security, we would be remiss not to talk about the overall health and well-being of our greater North Texas community. As you can see, where you live matters. If you live in higher income areas, you are more likely to have access to many nutritious food choices, many grocery stores, many hospital systems. Have your choice and pick of where you want to grocery shop, where you want to go outside and play, where your transportation method to a doctor, to a larger hospital system. Where you live truly impacts our overall health and well-being. And as you can see, in some of our under-resourced areas, there are drastic differences between life expectancies. This is pre-COVID. So we know that COVID really expanded upon the disparities across our North Texas area. And so pre-COVID, we already had a huge discrepancy between life expectancies in Collin County versus the rest of our North Texas area. But looking in Tarrant County specifically, 76104, which I know we talk about often in just when it comes to nutrition access, when it comes to life expectancy, but it is just important to note, to have and keep in mind that it is the lowest life expectancy in the state of Texas, and it's low compared to many other countries as well. So what can we do when we're looking at access points, when we're looking at food access, transportation access, looking at what we can do to really support our zip codes that are most under-resourced, and then recognizing also the importance that something like school meals play, right? How that plays into parents who might be living paycheck to paycheck, the burden that it takes off of them, knowing their child is going to get breakfast, lunch, and an after-school meal during and right after the school day is a huge help to those parents that can really help meet those needs and help fill in those gaps when budgets are tight and unable to get that the resource and the help that you need. So again, I mean, you'll hear school meals a lot because that's really what we're going to talk about when it comes to advocacy, or not only thing, but one of the pieces, because that really is where advocates and volunteers like you can have a say and can really have your voice heard. And I would also want to also ask, please stop me. I can keep going for on and on and on. If you have a question, feel free to put it in the chat, but also feel free to come off mute and just ask away. I'm happy to keep talking. Next slide, Elizabeth. So I just want to briefly touch on this, but when we talk about social determinants of health, a couple of percentages to keep in mind. I find this picture fascinating because the Robert Wood Johnson Foundation's County Health Ranking Initiative found that our health is shaped by more than just going to the doctor. It's 20% by genetics, 20% by behavioral factors, 20% by clinical care, and the remaining 40%, nearly half of our health, is determined by our social, economic, and physical environments. That's what we call the social determinants of health. So where you work, live, learn, play, and pray, it really, really does matter. Just an example that to keep in mind, it's incredibly difficult for an individual to get and stay healthy if their closest sources of nutrition are at a gas station market down the street or the fast food restaurant around the corner. Add in the fact there's no sidewalk to safely walk to either of those locations. And if they did want to walk, it's poor air quality around their house, which exasperates their asthma to get to that to that small market. And so all of those factors, which are out of their control, impacts their health just as much, if not more, than the genetics that they're carrying inside them since birth. So really, really important for us to have our voices heard when it comes to advocating on behalf of our communities and of our neighbors and our friends, because those pieces that we can change actually have an enormous impact on the overall health and well-being of our communities. Next slide. So when we talk about food insecurity in North Texas, I'm going to use that food insecurity term because that's really how this data is counted. It impacts households across North Texas, both young and old, all anyone. You can live anywhere and still have less access to food. And remember that not having access to food is also more than just being hungry, because food insecure children miss more days of school. They have a harder time concentrating while they're in school and are at risk for chronic diseases later in life. And the same it can be true for adults who are food insecure. So they can have higher absenteeism at work, and it puts them at risk for additional chronic diseases. So addressing food insecurity, addressing hunger, is important because it has a ripple effect into other parts of our lives. And when we look at, next slide, Elizabeth, when we look and put these numbers into something that we all really kind of an easy visual, because it's football, and football is, I was listening to the radio today. The Dallas Cowboys had a pre-draft conference, and I think it was all the radio stations, because it really is very, it's a big deal here in North Texas. And so, and thinking of Cowboys terms and football terms, you could fill Cowboy Stadium nearly seven times with the number of North Texas residents that lack access to healthy and affordable foods. 7 times. That's how many people in our area pre-COVID did not have consistent access to healthy and affordable foods. Next slide, Elizabeth. Looking at a map, I have looked at this map many times, and as I was getting ready for this presentation, something else struck me. So I'll certainly bring that up to the forefront as well. But looking at this map, it was made with the blue dots are where our major grocery chains are. So like Kroger, a Target, Walmart, Supercenter, Whole Foods, those big, large scale grocery stores. And you can see that there's a lot, not as many holes in Tarrant County, so that's certainly something to be applauded as there are in other areas, but some large holes. And the darker the color, that extra layer there is SNAP. And so those different colors, the darker the places, the more, the higher the SNAP percentage for people living in that area. And so looking at all of the red, the dark red, I find it fascinating in a not great way that the people who are needing access to these major grocery stores do not have access to them. And yet they're using their SNAP dollars in these areas, meaning that they're relying on not grocery stores, on gas stations or very small markets that might not have all of the resources that they need. And that's where they're buying their groceries. So I find it very interesting. Something I hadn't thought about, that layer, is that not only are we seeing higher SNAP usage in these darker areas, but there's not necessarily a lot of great big blue dots in those areas. So recognizing that we've got some work to do, that we've done some great work, and there's been a lot of great work in Tarrant County around double dollars and trying to increase access for SNAP participants and increase SNAP participants, but there's still some work to do in trying to ensure that our communities have access to healthy and nutritious foods. So why is it important, and why are volunteers vital to the work that we're doing? Next slide, Elizabeth. It's because you all are the voices that representatives, decision makers want to hear. I know we have Representative Collier on, so she can speak to that, certainly speak to that. But it's not always great to hear from me, who might not be a constituent, but I know my facts, but I'm not a constituent. I'm, don't necessarily live in the area that's being impacted. So being able to utilize volunteers and advocates like you, that's how our message has a stronger voice. You're able to provide that insight for the representative, for the state senator, for the mayor, for the city council member, for the school board member, of how it is in the area that they represent. So it's really important for our work to be able to bring you all along, and for you to be the voices that our decision makers are hearing. You have that be able to speak boots on the ground that we wouldn't necessarily be able to speak to. You're also volunteers and having advocates work with us, not necessarily just going and speaking to decision makers, but also helping in the planning and the strategizing is incredibly important as well. This picture is of one of our longtime volunteers, Miss Anja Sanders. Douglas and I have talked a lot about some of the work that we've done in food access, and there are many different voices in the food access landscape. There are some that really want to focus on urban agriculture. There's others that really want to focus on grocery stores, others that really want to focus on smaller markets, or others that really want to focus on vending machines. I'm just kind of throwing everything out there, but everyone has a passion. And so it is important for us as the AHA to make sure that we listen to the needs of the community. It does not make any sense for the AHA or for any other organization to go to a decision maker and say, we think this grocery store A should go in this community. Because if we haven't spoken to the community, if we haven't spoken to the residents in that area, we could be very off. And we might get a grocery store in that area, but it might not be what the community wants. And then that more than likely will fail. And so being able to work with volunteers that live and work and play and pray in these communities that are under-resourced is incredibly important for the work, because it just ensures that we're going on the right path, that we are not putting something in a neighborhood that wouldn't like it, wouldn't utilize it, but making sure that we're taking appropriate steps. And that's where you all come in, and you're able to provide that voice and that guidance. And so we're very, very grateful to that, to you for that, and grateful for the work we'll be able to do in the future with all of you on this call, to be able to have those voices and put those voices in front of our decision makers all across North Texas, but then taking it to the state as well. Next slide, Elizabeth. So when we look at nutrition security in particular, what can we do? Well, SNAP Double Dollars is one. We have had a lot of conversations about how we can ensure that that SNAP dollar goes further. SNAP Double Dollars is one way that we can do that. It is to ensure that SNAP users, when they buy locally grown produce, can double their dollar. So instead of just getting one banana for $1, they're able to get 2 bananas for $1, because there's a matching amount that goes when they're using their SNAP card. There's a lot of work that needs to be done. The city of Austin is currently operating a SNAP Double Dollars program. Blue Zones Project in Fort Worth is currently operating a Double Dollars program at farmers markets. And so there has been some really great movement in this, but expanding it is really what we want to do, to make sure that those individuals that are qualifying for SNAP, that have those SNAP dollars, that we're bringing those double dollars places to them, so that they don't have to take 5 bus rides and walk a mile to get to where they can use those dollars, but being able to use them in a place that's convenient. Food insecurity screenings, ensuring that our clinics, when our clinics are when you're walking into a clinic, is your clinic asking you, do you have consistent access to food, to healthy foods? Because a lot of our clinics that we work with have implemented this, and they found that, it's not just that a person might not have access, they're taking their medicine, they're doing everything right, but they don't have consistent access to food, and that's impacting its health. So, we're looking at taking this outside the clinic space. How can we make sure that our YMCAs, that our Boys and Girls Clubs, that our other community partners are implementing a food insecurity screening as well? When you're signing up to play baseball, are you seeing those questions? Because when you are answering them and more people are being identified, we can ensure that they're getting the right resources. So that's another great place. Just thinking of the volunteers we have on this call, if you work, where you work, is this an opportunity for you to implement a screening so that you can identify those that might need resources, connect them with SNAP, connect them with WIC, connect them with other resources, make sure their children are signed up for free and reduced meals at school. So looking at how we can first identify and then start to really address and get those, address the problem and get the resources we know that are available to the people that need them most. School meal programs. I'm going to briefly talk about this because Catherine and I are going to get into it for just a second, but looking at school meal programs, how can we ensure that all of our schools are serving universal school breakfast, that every child, no matter if they're late to school, if they're, can't get to the cafeteria before school starts, that they can eat it in their classroom, that they can grab a bag on their way to classroom and eat it in the hallway. How can we ensure that innovation is being used in school districts to ensure that kids have access and that we destigmatize getting a meal at school? And then looking at pantry programs, there's not just one. I firmly believe there's not just one answer to addressing nutrition security in our community, but we've got to have a lot of layers. And pantry programs are one where we can meet people where they are. So how can we look at school pantry programs? We have had the opportunity to put a pantry program in Maudie Logan Elementary in Fort Worth ISD. We're in the midst of putting one at Lucille Collins Middle School in Lake Worth ISD. I know the Blue Zones Project has put several in the Stop 6 area. And so how can we look at doing this more to ensure that our communities can grab, maybe they're at the end of the month, their SNAP benefits haven't re-upped, but they need a little bit to get them through. How can we ensure that there's somewhere close for them to access that food easily and quickly? And a pantry program is a great opportunity. I'm going to take a break because I see a hand up. Dr. Claiborne, did you have a question?
I did. Can you guys hear me, or is this really bad?
Yeah, no, I can hear you.
Okay. On the SNAP double dollars, is that just for, you mentioned some farmers markets in Fort Worth, you mentioned some things in Austin. Is that just for the people that live in that area, or if a SNAP user from, I don't know, Brownsville was at one of those farmers markets or was at that specific store? I'm sorry, my dog is losing his mind.
You're fine.
Would they get the SNAP double dollar benefit as well?
So I'm going to ask Alec to back me up, but I believe it's open to any SNAP user. It just has to be at that market. Is that correct, Alec?
That's correct, Jenny, and I'll speak a lot more about specifics later.
Okay, thanks, Alec. I appreciate
you. We're going to let the expert talk even more about it. Thanks for the question, Dr. Claiborne.
Of course, my pleasure.
All right, next slide, Elizabeth. So we're going to dive a little bit deeper into the school food topic because this is one where we have had a lot of success utilizing volunteers to really get schools to look at how they can expand a program. So I'm going to bring Catherine on with me, and I think something to keep in mind is that there are a lot of schools that for the past 2 years have served meals for free and to anybody and everyone. And that's going to be changing because the waivers have ended. And so because of COVID. And so schools are going to look a little bit different. And when it comes to food service, we certainly want them to expand programs, but we also know that schools are facing a lot of hurdles. We've got a lot of staffing issues at schools with school nutrition programs, as well as supply chain issues. So there's a lot of opportunity to kind of go into this. But I have been talking way too long. So we're going to take a small break. And Alec, I think I'm going to hand it back to you so we can have our wonderful honorable speaker be able to have some time. Oh no, Alec, did we lose you?
Oh, I'm sorry. I was not pressing the mute button correctly.
That's okay.
Thank you, Jenny, and thank you everyone else for being here and for being patient with our reshuffling. I'm sorry, I think my computer was cutting out. Are we ready to move? Are we ready to move on?
We are.
Perfect. Perfect. Elizabeth, do you want to pull up our intro slide for our guest speaker? Thank you. And Representative Collier, thank you for joining us and being patient with our tech issues, everyone. We have our guest speaker here today. This is State Representative Nicole Collier. I'm going to give her a quick introduction before she intros up our next part of our presentation. So Representative Collier is a practicing attorney, a small business owner, a grandmother, and a mother of 3 who has spent her life working to obtain the American dream. As a single mother of 2 before finishing high school, she was bolstered by her faith and family to continue her education all the way through law school. Nicole graduated from the University of Houston and married Gary Collier shortly thereafter. Gary and Nicole established their home in Fort Worth. For the last 20 years, Nicole has been a strong advocate for individuals and families and has now taken her skills to the state capitol. Nicole is the first woman to represent House District 95 in Tarrant County, and in November 2020, she was reelected for her 5th term in office. Nicole's appointment as chair of the Criminal Jurisprudence Committee during the 86th legislature made her the first woman in Texas history to serve in that capacity since the committee's formation in 1879. In the 87th legislature, Nicole was reappointed to serve as the chair of the Criminal Jurisprudence Committee and appointed to the Public Health Committee. The Texas Legislative Black Caucus elected Nicole as their chair in 2020, and she also serves on other caucuses in the House of Representatives, along with the Texas Indigent Defense Commission. Representative Collier, thank you for joining us, and I will let you take it from there.
Oh, well, thank you so much, Alec. Good afternoon, everyone. Thank you so much for allowing me to be here. I'm so glad I got a chance to hear the presentation. It just really, brought it home, the importance of the work that you do. I'll admit, before I was elected to office, I wasn't very familiar with all the work that the American Heart Association did. You think that, oh, they just deal with people who have heart attacks. Well, that's not true. You want to do preventive. You actually do preventive work within our community, making sure people have access to quality and healthy foods and healthcare, because we do know that stress is part of the whole healthy lifestyle. So I want to thank you for the work. I do always appreciate when we have people who come visit us at the Capitol or here in the district office, because it's important that we speak with people who have their fingers on the pulse of the community. I'm a lawyer by training, so I don't know everything. No one knows everything, and that's why you have to build a community, build a community of stakeholders who can come together and share information and also advocate for good policy or good measures to help Texans. And I remember I was elected in 2013, and I know you heard Alec talk about my bio. I'm a mother and a grandmother. I had my first child when I was 16, when I was a child. I had my second child. I had 2 children before I graduated high school. So I was on food stamps. Now they call it SNAP, but food stamps was very important to me to make sure that I had the products for my children. I mean, literally, if I didn't have access to food stamps, I don't know what I would have done. So, we have measures like this. We have things like these programs in place because people like you that speak up for the vulnerable parts of our population, for our children. And we could get lost in, bureaucratic paperwork and trying to count pegs to make sure that they have done everything. But when the more barriers you put up to access, the less people will participate. So we've got to make sure that we continue to hear from you, and you can tell us what's working and what's not working. And I remember my first legislative session. I have a picture of this. We went into a special session, but my first legislative session was very, it was tough because there was issues that came up that dealt with access to SNAP. And there was a bill that was filed that would require drug testing for SNAP recipients. There was no evidence of waste or over, fraud, large scale fraud. It was just a notion that somebody had that they thought it was going to be a good idea to drug test SNAP recipients. Again, another barrier, no proof that there was a lot of fraud and waste going around, but just something somebody wanted to do. So I keep this picture up in my office. I don't know if you could see it, but this was in the middle of the night. It was like 3 a.m. where we talked about it. And I shared my story of how I was also a person that received food stamps. And so sometimes people think and they have that person in their mind and they may not look like what they think or expect. And so I wanted them to remind them that I too, while I'm one of you, I was also a food stamp recipient. And so it's important that we put faces on the people to let them know that it impacts so many people. The work that we do impacts so many people. And if we don't have programs in place that can help people get ahead, they may not be able to one day serve in the legislature or become the doctor or lawyer, the teacher that we need in our society. So I just want to tell you that I thank you so much for your work. It's important, again, that you share what you see and the issues. I mean, everything that you talked about, that's my district, House District 95, these food deserts, my district. I am grateful for Blue Zones and what they can and will do. to provide healthy food options, but there's more that can be done. And you can help with that by sharing your stories and sharing your message and sharing what you see with legislators like myself and other legislators, so that they know that these are real people, people's lives that we're dealing with. And it's not just something that we can, write a bill and it's going to change, and make the process easier. In fact, it can make it harder. So we need your help. Continue to come by our offices. Last session was a little bit different. We did more Zooms, but we're back open now. Please come by, share your information. And I always appreciate the opportunity to hear from you. So be on the lookout for legislation. Sometimes they're wolves in sheep's clothing. You got to really review the bills that are filed and think about the impact that they're going to have. Is it going to make it easier for you to do your work and increase access to healthy foods, or is it going to make it harder? Because we want to improve the lives of Texans and not put up any more barriers. So thank you again. I want to encourage you to continue to volunteer, because your work matters, you matter, and we appreciate you for all that you're doing in our community and in the state of Texas. So Alex, that's about all I have, and I'll answer any questions if there are any.
Thank you so much, Representative Collier. Are there any questions for the representative while we have her here?
I'd love to ask a question if I can. Thank you so much for being here, Representative Collier. This is Brittany Claiborne. What you said, sometimes the bills can be wolves in sheep's clothing. Do you have an example of one that you've seen personally, or that kind of stands out to you in that regard? Sorry, I can turn on my camera here.
So there was a bill in 2019, I think it was HB 285, and it would prohibit the Texas Health and Human Services Commission from seeking a waiver from the federal government for the work requirements for certain people. There was some type of, somebody said that they think that there's fraud and abuse within the system for those who are 18 to 50 years old. But Texas Health and there was a bill, the bill said that they couldn't seek that waiver. Well, we need to be able to provide our agencies with flexibility to take that action when it's necessary. They know more because they're doing it on a regular basis. So when we remove that tool, that option from those agencies, it limits their ability to help the community. So, we need to be able to continue to let our agencies have that flexibility. But that bill, luckily it didn't pass, but it would hinder the agency's ability to make adjustments when needed. And so that's one example that I can come up with right now.
Thank you. Also, is there anything that we as the people that are kind of living through the process, the constituents, able to do, like you said, come into the offices, write the letters, do the things, but is there anything we could do? Like, I guess what I'm saying is, how often, or is there an impact of social media on some of these issues now?
That's a really good question. I'll answer the first part. Now, you could also testify. Last session, we made it even easier for people to testify because we implemented in the House the pandemic rules, which allowed witnesses to sign up online and testify online. Hopefully, we can make that permanent. We'll have to vote on it at the legislature, but it was more accessible for those who wanted to participate to do so, because you could do it virtually. So in addition to calling, writing, emailing your legislator or your senator or your congressional member or your U.S. senator, you can also sign up to testify on the bills. Any legislation that is going to impact the work that you do, you can sign up to testify about it, or you could submit written comments through the public comment portal. Yes, social media does have an impact. Unfortunately, it hasn't been positive. because what we see is when someone raises something negative, it catches hold and people run with it, and they think that that's something that they have to do and make it that way for everybody. And I'll give you an example. We may disagree on this, but UIL, they had a bill that said only though you had to play with your birth gender. Well, that's already the rule. Why did we have to pass a law for it? It's because something happened in another state that really wasn't happening here in Texas, and they ran with it because of the fear that is in their mind, not in reality. So it can happen with the social media, and it hasn't been very positive. I wish they would catch on to some other things and run with them.
Well, and I guess that's kind of where my focus is we have access to all of these platforms now, and obviously the negative things do catch on, but is there a space where, you know, if someone were to say, hey, we're just going to talk about the positive things, we're going to push those bills, we're going to push the healthcare things in these spaces, if that would have an effect, a positive effect as much as the negativity has an effect? Is that something that that would get the attention of the legislator, just like the negative things do?
Well, you always have to be ready to play defense. And I'm glad you brought that up, because let me tell you, so often, too often, I see organizations that will go support something. They'll say, oh yeah, this is in line with what we believe in. But if there's something that is filed that is contrary to your goals, they don't speak up. And so it's important that you do both. You have to be able to speak out against those measures that would hinder your work. So that's something that I do encourage you to expand your consideration for. I told this to United Way. I tell it to anybody I can, Boys and Girls Club. If there's a piece of legislation that is filed, don't be afraid to speak out against it. I mean, that's what you use your collective voice to do. Maybe you do it just as you as an individual, but if your organization, if you have a process that votes on something and you guys agree that this is the issue that you're going to oppose, then absolutely, each organization has their own process. So I think that, you follow whatever your organization's process is, and then you do it, but don't be afraid. I can't tell you enough how much I get disappointed when organizations don't speak out against bills that negatively impact their work.
That's an amazing thought, and I didn't even think we think about putting things out there, but I never thought about speaking out against the things that are counterproductive to where we want to be. So thank you for that comment. I appreciate your time.
Thank you.
That's a great point. Thank you, Representative Collier, and thank you for joining us and for sharing your story and encouraging all of us to share our stories. We really appreciate your time and your patience with all this, and we're looking forward to working with you in the Public Health Committee next session to hopefully move some of these issues forward. So thank you for joining us.
Thanks. Bye-bye.
And with that, we are going to return back to Jenny and Catherine to talk more about our community and school pantry initiatives. Hi, Jenny.
Hi, thanks, Alec. That was perfect. You got to kind of hear confirmation of the importance of having constituents go and speak to decision makers. I loved it. So
absolutely.
Yes, it was perfect timing. So now we're going to get to talk a little bit about how you can get engaged at the school level, which I think can be a little bit, I mean, for me, I have a daughter that just started kindergarten. I work in this space. I talk to school districts often, and it's still a little bit hard to navigate even my own when it's my child. So, we talked a little bit about the importance of having your voice heard when it comes to some of these school meal programs, because school meals can be a really important part of a child's life. I was able to go through a poverty simulation earlier last week, and it was I was the grandmother in a family of 4, and we were trying to make sure we had enough money for groceries, and we had a child that was in school, and it was so wonderful to be able to know that we didn't have to account for meals during the week because for our child, because they were getting them at school. And then spring break hit, and that's something that parents really have to focus on when their child's not able to get those meals. And so just really wanted to touch on that importance that the important role school meals play when it comes to helping out with nutrition security, just that the level that it can really help families. So Catherine, I know you and I have had the pleasure of working together, or I hope it's been a pleasure for me. Hopefully it has been a good pleasure time for you working with me as well. I will not speak for you though. But I wanted to kind of let everybody know how you started in the nutrition field that's really led you to where you are today, because you and I have come to this in different ways, and you've got a lot of experience. It kind of helps form how you go about this. So I'll toss it to you.
Sure. Thank you, Jenny. It has been a pleasure working with you and continues to be a pleasure. Just want to make that clear for everyone. I got started in nutrition. I, like the representative, became a young mom, and all of a sudden I had this baby that I needed to feed and feed well for her health and her well-being. And I started feeding her. I got a book. When I found a book, I'm a research person, so I went and found a book. I was like, please tell me how to feed this child. I don't know, and I want to make sure she's okay. And so I found this book that really broke down nutrition in a comprehensive way for new mothers, and I started feeding her. And then I recognized, oh, well, I can't be sitting here snacking on Oreos while she's eating a really healthy meal. So it also changed my diet as well to be a better parent and advocate and role model for her. And then down the line, my daughter actually developed some chronic conditions that were diet related, or could be combated with diet. So really, and we were a low income family, and I myself was also trying to figure out how to feed her healthy on this budget, avoid the cost of medication that we were paying, because the medicine was way more than groceries. And so through a lot of self-education, I realized, oh, this is a problem everyone has. This is not just my problem. And I wanted to help other families not be in that same situation, and recognize the need for education and for people who are experienced in nutrition to really shape nutrition policy as well, which is also why I started to go down the route I did. So I also went to ACU and got my degree in nutrition there, and then jumped into, that got me introduced to school meals and food security work from there.
Awesome. Thank you. And so you've gotten to see both sides. You've worked for a school district and in our wonderful West Texas town of Abilene. And then on the other side, kind of advocating, or not kind of, but advocating for expansion of school meals. So kind of putting back on your school hat mode, how influential was it to have parents reach out to you, or community members reach out, to talk about expanding school meal programs, such as expanding breakfast or expanding after school? How did that kind of influence decision making, or just kind of thinking, maybe about addressing school meals a little bit differently?
Well, so school nutrition is interesting because it is a business first and foremost, and they're in the business of feeding children, which is an interesting mission. Their customers are their children they're serving every day, and those are their babies that they care about greatly. And so for a parent to come in or a volunteer, well, you're customer satisfaction first and foremost. And if you're unsatisfied with the meals and you're not participating, well, that hurts our business. And so your voice is valuable. They want it to be a positive experience for you. They want it to be a positive experience for your child. They do want to serve as many meals as possible, because at the end of the day, while their first mission is feed children, their second mission, you've got to run a business efficiently. And so I think that's where parent voices and parent volunteers are so influential in expansion of programs. Maybe even more so, Jenny, you and I have experienced going into a school district and trying to convince at times, or woo them to expand their programs. And I think a parent can even be more valuable because they are that direct customer link.
Yeah, that's really good to keep in mind. I forget sometimes it is a business. Absolutely. And so talking about now taking your school nutrition director hat off and putting on your advocate hat. I kind of want to just really quickly lay the groundwork because we're kind of using a lot of terms that I use and get carried away. And I want to kind of take a step back to make sure that everyone on the call, we're on the same playing field with this. So when we say universal school breakfast, that means that a school district is serving school breakfast universally to everyone for free. So you've got a lot of school districts that do that in a variety of ways. Some do serve it for free, and then they serve it in the classroom. So children can come into school, they might grab a bag of breakfast, and then they can go eat it in the classroom. Or they might go directly to class and breakfast is served to them in the classroom. There's a lot of different models, but when you're serving it universally for free, you don't have to collect cash. You don't have to take, a lot of information from kids. Easier, and more kids are eating. So to Catherine's point, more meals are being served. More money, in a sense, is being made for a school district, which can be very helpful. But it also it's a lot to put together. And so we have many school districts, and I would say Fort Worth ISD is one of them that does not, they do have some schools where they serve for free to everyone, but it is not a district-wide policy. And so when you're talking about Tarrant area schools, Fort Worth ISD is one of them that we would love to see do a universal school breakfast program and feed all of their kids for free breakfast and lunch. And so we can think Fort Worth ISD being our example. But Catherine, we've had some great success bringing together parents and volunteers to help spread the word about school breakfast because when it's served for free, and it's served to everyone for free, more kids eat. That stigma of having to be that kid that had to take advantage of the free breakfast is completely reduced because now anybody can eat breakfast. And it's just it's better to start your meal with your day with a healthy meal. So could you just kind of talk to some examples you've had of being able to use volunteers, community members to help you advocate for some changes at school district levels?
Yes, I think we've been so fortunate because we've had some campaigns like Breakfast Battle that allowed us to get input not only from the kids directly, but then their teachers, and then that expanded, beyond they were taking that project home and working on it as well. And that allowed us to really get their input on how, one, they wanted the program to be served in their school. But then two, they had a platform that they haven't had before. And it really was eye-opening as there tends to be a disconnect sometimes between administration and school and child nutrition services because they're not always housed in the same building. They're working in different times in different parts of buildings. And so that really allowed everyone to come together at one time and hear problems that administrators weren't recognizing and that also child nutrition service members weren't recognizing as well. And so that is a key voice that gets heard. Like the students made a point. They were like, hey, we're walking through this door and breakfast is served here. So across the building, and we can't get over there in time in that short passing period to get our breakfast. And it was like, oh, well, duh, we can put a grab and go cart there and make it very easy. And you can take that breakfast to your classroom. And so we've had success like that. And I know you've done some more parent campaigns as well in other school districts that have been instrumental in getting programs shifted and expanding them as well.
Yeah, so I think, again, when parents are able or community members are able to reach out to school board members and say, go and testify, kind of, Representative Collier said about testifying at the state legislature. You can testify at a school board meeting too. And so being able to go to school board members and tell them, why school meals should be expanded, ask questions as to why they're not being expanded, and being able to, go that route. Also, you can join the School Health Advisory Council. School Health Advisory Council is mandated by the state of Texas. Every school district has to have one. And that's a great place to be able to have your voice heard. It's supposed to be highly made up of parents. And so parent voices are always needed there. And just a great way to be able to get involved and have your voice heard on that. Want to kind of keep, obviously school meals being very important, but Catherine, you also sit on the Tarrant, you're part of the leadership of the Tarrant County Food Policy Council, which is another way, maybe school meals is not really where your passion is, but maybe looking at expanding double dollars or expanding access to corner stores and healthy food in smaller markets. Could you talk a little bit about the work of the Tarrant County Food Policy Council and how that's another way volunteers can get involved if maybe school meals isn't what they're looking for, maybe outside the school space could provide you with an option?
Yeah, so Tarrant County Food Policy Council has some really cool opportunities coming up, especially around volunteers. One of the strong suits of the Tarrant County Food Policy Council is they have a really strong community garden urban agriculture team. And within that team, there's this group called Grow Southeast that is focusing in those zip codes that you showed in those high SNAP areas and low grocery store. There aren't as many grocery stores in those areas, and they're building urban farms. And those farms are now going to be accessible to bring healthy, nutritious food directly to the community, right? Because as we talked about, food security is different than nutrition security because we have access to food in those areas, but is it high nutrition quality? And what kind of detriments are those having in your health if you're eating food that's not of nutrition quality all the time? And so those groups are volunteering. I actually just volunteered this past Saturday on one of the farms, and it was very exciting to see because it had a year ago I saw it was a field of nothing but weeds, and now they're loading up tubs and tubs of greens and radishes, and they're going to be having our first farmers market this weekend where they're going to be able to sell directly to the community at low prices. And so that's exciting, and that's some of the work the council does. We have our child health working group that is looking at changing some policies around Fort Worth to make healthier drink options in restaurants the priority and what's opted first. So there are multiple opportunities, but getting involved with councils or coalitions is a great learning opportunity. It immediately lets you get in kind of on the groundwork and see what your community's doing, because there are tons of us doing work. We don't always recognize who's doing it. And so joining a council or even attending one meeting gets you to allows you the opportunity to learn, and then it allows you the opportunity to get engaged directly as well.
Well, I love it. We, the AHA gets to sit on that council as well. And so grateful for the work that's done there. Grateful for you coming on and sharing a little bit about the great work that can be done and the impact it can have at schools. Remember, 220,000 kids are eligible for, or are utilizing the free and reduced meal program. And so being able to support that is one great way to take a chunk out of our food and nutrition security numbers. So grateful for your time today, Catherine. Thanks everyone for listening. I just appreciate the enthusiasm of this group, and I'm grateful to have some wonderful advocates on the call. Alec, I will pass it over to you.
Thank you, Jenny. Thank you, Catherine. For sharing. I know some of the feedback we got is people wanted to hear more about how we work with our local partners and get some of these programs actually implemented. So I'm really glad you both were able to join us. Thank you. Now, Elizabeth, if you're able to pull up the PowerPoint, we're going to talk a bit more specifics about food security and nutrition policy and exactly kind of some of the background and mechanics of what we're asking for from policymakers. So if any of you have questions about this, I invite you just to either drop them in the chat or go ahead and ask them between slides, because I know some of the questions can get a little specific. So I want to make sure we address them while they're up on the screen. So we can move to the next slide. So I want to just lay out kind of the full range of the different things we ask for from policymakers, whether that be from ISDs, school districts, from local governments, from the state. And so they fall into two broad buckets. One of those is improvements in access to healthy foods, just making sure that people can get the food in the first place. That includes things that we've been talking about, SNAP incentive programs and double up bucks that make it easier for people to actually afford them. And also things like removing barriers to enrollment in these benefit programs. So for example, there can be a lot of rules and restrictions and qualifications put on who can qualify for these benefits. And sometimes those are appropriate and sometimes those aren't. And a lot of times they provide opportunities to get those benefits to more people. Excuse me. The second bucket, we have improvements in nutrition standards and quality. So that's kind of with knowledge that a lot of times people are already getting food, getting fed at these places, but we want to increase the quality and health of what they're eating. So one of those options is a sugary drink tax plus investment. That means that the taxes on those sugary drinks like sodas would ideally go back toward investment in those communities that are the most affected by sugary drinks, by the health effects of sugary drinks. A step on the way to that goal is healthier restaurant options for children. We know a lot of restaurants just don't necessarily offer what families need in order to feed themselves healthy. A lot of times they just don't put those options in front of people. And so by increasing the availability of those options for families, we can make sure that where they're already getting fed, they can make a healthier choice if that's what they want. And then finally, what we just heard a little bit more about was school food access and quality. We know that a lot of children in Tarrant County and the state and the country get some of their most important meals and sometimes their only meals at school. And so there's an opportunity there to make sure that they're not only being fed, but being fed valuable, healthy things that will set them up for a healthy life path. We can move to the next slide. So who makes nutrition policy? As you can guess, there's opportunities across government from the school district all the way up to the state level. At the state level, the governor, the legislators, like we just heard from, also regulators, they issue the standards that everybody else has to comply with. So they can kind of set that baseline for what nutrition means in a school setting or in a childcare setting. They also manage these public benefits like SNAP for the federal government, so they can decide what restrictions are or are not on those programs. And then finally, they have the really big budgets to start entirely new programs like SNAP incentives, like food pantry programs. Just because of the scale of the state budget, a lot of times they can take on programs that just don't make sense for a city to talk about. In terms of what does make sense for city councils and county commissions, they have health and safety powers. And what that means is that they can determine a lot of what goes on day to day in terms of nutrition standards at restaurants, sometimes in schools as well, in terms of making it easier for people to actually get access to these locations through the transit system. And so there are a lot of opportunities to work with local governments as well to improve the overall systems that people are using at the local level. And then finally here we have school districts, school boards. As we know, they can go above and beyond state nutrition standards if they have the the ability to pay for it, the ability to find those sources for nutritious food. They can. There's no reason that they need to meet the very minimum the state sets, and they can go above and beyond. We can go to the next slide, Elizabeth. So now a question for you all. It should pop up on your screens, but you're also welcome to share off mic or on mic if you'd like. What do you think would be most challenging about advocating for these policies in the first place? Would it be that they're pretty expensive? As you know, food is expensive and somebody has to pay for it. Is it that, a lot of times there's anti-welfare or anti-nanny state sentiment and people don't necessarily want to fund those programs? Or just that there are a lot of moving parts to food systems and sometimes it can be difficult to explain what these programs do. So I'll give you all a few seconds to, or a few moments to answer this poll. I see it up on my screen.
I will let you know when most people have voted.
Yeah, let's give it a few more seconds. So we got 9 of 17.
All right, let's see.
Interesting. So I had guessed most of you all would go with anti-welfare state sentiment, which looks like many of you did, but a lot of you also chose explaining complex food systems. Does anybody want to share thoughts they had on this question? If not, that's okay. Gonna stop with that question. Elizabeth, we can move on to the next slide. So now some more specifics about what will almost certainly be one of our big 2023 goals, which is SNAP incentive funding. These are often called double up bucks, is what you might have seen locally. But basically what they do is they provide SNAP recipients with a financial benefit when they spend those SNAP dollars on fruits and vegetables. So how that usually works, what I've seen is if you spend something like $10, kind of relating back to the activity you all did ahead of this, you would get a voucher for another $10 that can be spent on more fruits and vegetables. We have a lot of good data that shows that these programs both make a big impact on people's health and what they're eating, and also an economic impact in terms of just providing that buying power to justify locating some of these stores, some of these products in areas where they might not otherwise. And this is also a really big issue over the past year or two, because all of you have seen the drastic impact inflation has had, especially on fruits and vegetables. There's a lot of data that shows that fruits and vegetables have been becoming more expensive at a much quicker rate than other forms of food. And we know that just practically when people are on limited budgets, that means that a lot of times they're going to displace those healthier fruits and vegetables with less nutritious food. And so we have a lot of these local level SNAP incentive programs across the state operating at farmers markets, or sometimes operating at grocery stores, but mostly that is with federal or private funding. And we know there's still a really big opportunity for state support. Holly has a question here about whether that applies only to fresh food or whether it applies to frozen and canned vegetables as well. So the programs can be set up a lot of different ways. Typically, it's only for fresh fruits and vegetables. And in Texas, it's likely that it would be only for fruits and vegetables that are grown in Texas, which I can explain a bit more on these next few slides. You can go to the next slide, Elizabeth. And so just some recent history on this issue about what we've been doing around SNAP. In 2019, there was a bill that Representative Collier actually co-sponsored that created a pilot program for SNAP incentives. Now, it created that pilot program, but it did not create the funding for it, which means the state didn't actually get it off the ground. And I'll explain a bit more about that in a little bit, but this is just the history of how that happened. Another thing that bill did was create a work group of advocates and researchers and some legislators just to talk about what the program makes sense for Texas, what impact it's already having, and they delivered a pretty favorable report to the legislature in 2020. In 2021, that's last legislative session, because remember, Texas meets every 2 years, we also helped work on and pass a bill that improves SNAP access. So what that did is going back to our discussion we had about the state deciding whether or not to put up barriers to enrollment. This was a bill that allowed seniors and disabled persons in Texas to have basically a much simpler application and recertification process for SNAP. So we know that those groups are not groups that tend to move off and on of SNAP eligibility. So it doesn't really make sense to be checking every 12 months about whether they still qualify for SNAP. And so for them, we were able to pass a change that allows them to do it every 36 months and to do a way simplified recertification form rather than a very detailed one that would involve a meeting or phone calls. And so just another example of how there are ways to adjust kind of the margins of these programs to really affect how people are able to take advantage of them. We can go to the next slide, Elizabeth. And so looking ahead to 2023, we have 2 slides here showing kind of where we are in terms of progress on that issue and our strategy for getting where we need to be. So it's helpful to look back on what our strategy was in 2019 and why we still have remaining pieces to work on. So when you have a big program like this, sort of the best ideal approach is a 2-track strategy. So what you do is you file a bill that creates the program. It says, here's how the program should run. Here's who manages it. Here's all the other little details. And then in the budget, you put in $5 million, $1 million, $100,000, however much it costs, and you say this money is for that bill. And now that's the perfect way to do it because you can set out all of the rules around the program and really make sure it's durable beyond that one budget that they pass every 2 years. That doesn't always work. Sometimes one passes and the other doesn't. In this case, the pilot program passed, but the budget item did not pass. So basically we have a pilot program with $0 in it that can't do anything. But that does give us an opportunity next session because it means that most of those details are already on the books. And all we really need to focus on is getting that money to get it off the ground. And so it really allows us to focus in on that one issue and not have to put as much attention into making sure that the other details around the program are perfect. And so as far as what our target for that program will be is, the American Heart Association determines what that number should be based on how many SNAP recipients are in the state. In Texas, we have, I think, about 3.1 million SNAP recipients. And so our target for that amount, really our baseline is $2 million per year. That's what we think would be the minimum to be an effective, valuable program that we have the science to support, makes the impact we want to make. But because the legislature in Texas tends to be very fiscally conservative, a lot of times they'll slice down these programs in the late hours of the budget to make room for other things. We're likely going to ask for a lot more than that. What I've heard from some of our partners on the ground is they think 5 or 6 million might be more appropriate. And even that, they think the state would be able to run through very, very quickly if they set up a good program, because these programs are very popular and really address a high need. You go to the next slide, Elizabeth. So a little bit more about this progress and strategy and what we've been doing so far to get this off the ground for next year. So like I said, we've been talking a lot with different organizations who are interested in this issue about what that funding amount should be, what our overall strategy should be as far as messaging, what legislators to talk to, who we want to carry that bill ultimately. We'll probably reach out to Representative Collier again to be a co-sponsor, but we want to create a good bipartisan group of legislators to make it the most likely to be successful. And we also have heard some discussions about a food security caucus taking shape in the Senate. So that would be a group of legislators, bipartisan in the Senate, who've said, this is an issue we want to be involved in. We want to hear from the experts, from the public health community about what's needed in Texas. And if that is a successful initiative that they put together in Senate, I think it would be a perfect place to talk about this issue and get other similar programs off the ground. Belinda asked in the chat if SNAP qualifications are trending up. I don't know exactly how the trend line is in terms of who's qualifying for SNAP, but I would just imagine the pandemic probably put a lot more people on the SNAP rolls, but I can look more into specifics around that for you also.
And Alec, you have a second question about if the program applies to fresh produce only or frozen or canned are included.
Yeah, that really is up to how the state is going to design it. In Texas, is because the way the pilot program was designed in 2019, it is specifically for fresh Texas grown fruits and vegetables, which in another state might be difficult to work with, but we figure there's probably plenty of Texas grown fruits and vegetables to make good use of all the funds that we'd be likely to get. And so the next part of this slide was next steps and needs. So kind of what we need to do between now and 2023 to make this a successful campaign. So like I said, we need to identify a sponsor in both the House and the Senate. It's not necessarily a matter of finding a sponsor because, as you know, this is an important issue that a lot of legislators would be happy to take on, but more a question of who do we think is best positioned to help move us through the process. A similar question is, what legislators do we really need to target for grassroots outreach? So who needs to hear from their constituents? Who needs to have advocates come to Austin to meet with them? Who are kind of those marginal votes who we can swing one way or the other, or those votes who we really need to solidify ahead of time and make sure they hear from us. We also just need to refine our messaging and talking points. There are a lot of different ways we can talk about this issue, and we want to find what will be the most effective for Texas. And then finally, we want to look for ways we can highlight those who stand to benefit directly, because as Representative Collier said, a lot of times the most effective thing you can do is share your stories, share how this issue affects you. And a lot of times that's a lot more meaningful than somebody just coming into the room with facts and data, no matter how compelling or true they might be. Another question in the chat. Oh, not a question. Okay, we can go to the next slide, Elizabeth. So another question for you all. What aspect of nutrition and access would you focus on for messaging in Texas? Like I mentioned in the last slide, there are a lot of different ways we can talk about this. And to a certain extent, that's a question of the legislator you're talking to in their district, what you want to lean on. But as far as, you know, our big public campaigns, our messaging to advocates like you, what do you think is the most compelling? I'll read them off for you all. Costs: with limited budgets and added inflation pressures, many Texans need help affording healthy food. Access: many Texans live in food deserts, and increased economic activity can bring more options to their areas. Or health: as we emerge from the pandemic, it's vital that we support Texans living healthy lives and avoiding chronic disease. Or other, and after we get a few more responses, if anyone wants to share what you think we could be focusing on as far as messaging, we'd love to hear it.
Yeah, I'm sorry if you can't read the answers, you can just hover over it and it'll produce the whole.
I can read them all.
Okay.
It looks like that's most of us. Do we want to wrap up the poll? The most answers were health. As we emerge from the pandemic, it's more vital than ever that we support Texans living healthy lives and avoiding chronic disease. That is interesting. I had thought that the cost one would be by far the most compelling. Does anyone want to share your thoughts on that question?
I can share.
Sure, Dr.
I
Claiborne.
chose health. Yeah, I chose health as well. For me, it's actually more about children, because and you know, I think this is an unfair question, Alec. Dang it, I just do, because I think it's a little
unfair. That's good feedback too.
I think it's a little bit of everything. I think that I really think it's going to come down to health. Actually, I think it's all of them. I think it's health, access, and cost, because at a time, like you said, everything is getting more expensive. So more people are going to work. So where mom or dad may have been able to stay at home and prepare a healthy meal, that's not happening because mom or dad, both parents, are outside of the house. So obviously a child can't prepare that meal. So I think and of course we need to avoid chronic disease because the pandemic has substantially weakened the immune systems of the American population just in general. And then not only that, there's, like you said, there's the food deserts, there's economic activity that's having trouble kind of getting back to its norm. And we're like someone just said, the new normal, and adjusting to that I think adjusting to the new normal is affecting cost, access, and health. And we have to pull all those things under control in order to promote a message that's honest. You know, I mean, we could pick and choose over these, and sure, make any one of them work, but I really think it's a true culmination of all of these things that need to be talked about. Maybe two more than another. For me personally, like I said, it would be cost and health. You know, my 11-year-old was told that, you know, he's being tested for a fatty liver. He's 11. That's not something that should be happening. I went and bought food today, and I found an old receipt, and it was literally 3 times what I paid in 2019, and that's insane.
Yeah, thank you, Dr. Claiborne. It's a really good point too about tying the messaging to kids, because at least me, I know I've been thinking so much about the cost issue. I may have been neglecting how to tie it back to, hey, there's somebody eating this at the end of the day too.
Right.
Does anyone else
Exactly.
want to share? Okay, we can move on to the next slide, Elizabeth. And then finally, I know Allison's going to talk to us a lot more about taking action on this issue, but I want to give you some background and key talking points about how we can generally frame this issue and approach these lawmaker connections. So I think the first big thing we want to do is emphasize how the issue affects you. And so first, just at a basic level, you want to tell the legislator who you are and why you're talking to them. So in this case, it'd be something maybe like, I'm part of the Heart Spark event, and we learned about something that is happening in your committee that we wanted to get in touch with you about. If you can, you want to also highlight an experience you've had with that issue. In this case, with budgeting for healthy food, or maybe as Dr. Claiborne was saying, seeing health effects of healthy food or unhealthy food. And then finally, bringing it back to data that shows it's not just you that's having this issue. You're a good example, you're an expert on it, but there are other people who you're helping speak for and helping advocate for. And then finally, especially now, it's great to consider the timing and schedules of what lawmakers are doing. Like Representative Collier said, they're not in Austin right now most of the time, but when they are, there will be those opportunities for in-person meetings. Right now, during the interim, lawmakers tend to have a lot more time to work on different issues, to think about opportunities, possibilities, or even to hear from people outside of their own districts. They're kind of in the mode where they're looking ahead to next session, really considering what their position should be. Once we get in session when things are a lot more busy, it might be more appropriate to make a phone call or get there to the Capitol and meet with your actual legislator so they can hear from their constituents ahead of an important vote. But in any of those situations, you want to make sure you're not just talking about an issue, you're not just necessarily speaking generally about something they don't know what to do about, but you want to tie it to a specific thing they're doing. Maybe there's a bill coming down the pipeline they're going to be discussing. Maybe there's just an interim hearing topic they're going to be talking about, or a big vote coming up. But they want to know exactly what you're interested in seeing them do. And if you can make that easier for them, it makes your meeting or message a lot more effective. And I believe that is my last slide, right, Elizabeth?
That's correct. And we will go to break right now. If anybody—
Does anyone have any questions before we do?
Yeah. All right, sounds good. We will give you 10 minutes. We'll start the timer. You can order your food, take a stretch break, restroom break, and we will see you back here in 10 minutes. We have an exciting guest speaker coming up, and you will hear from her, Miss Dallas, and share her story about healthy food access, and you will learn how you can take action to make a difference. So we'll see you back in 10 minutes. Thanks, everybody.
Well, hi, everyone. Welcome back. And thank you for hanging out with us for this evening's event. And I never mind waiting till the end to go because I'm always so excited about everything that my colleagues have presented throughout this call, because it builds to having a moment where you guys get to take action and be involved. And I know, based on a lot of text messages I've received from you this week and some phenomenal field trip pictures that you've really enjoyed this topic. So we're excited to talk about that with you guys. But first, I get to introduce you to someone really amazing. And I'm so excited she can make time to be with us today. Please welcome Jaylene Looper. Jaylene is an instructor for the National Cheerleaders Association and a face you may have seen on the Netflix documentary series Cheer. Having dealt with food insecurity briefly as a child, she has made it her personal mission to combat the hunger crisis in her community. After receiving the Lyrical Activist Award from the North Texas Food Bank in 2016, interning at the Hays County Food Bank in 2017, and becoming a certified SNAP aide in 2018, clearly she's busy, you guys. Jaylene is currently partnering with the North Texas Food Bank and Feeding Texas, and has personally raised funds for over 125,000 meals throughout her years of volunteering. As if she wasn't amazing enough, she is also your current Miss Dallas and will be competing at the Miss Texas Scholarship Competition in June in the hopes of becoming the next Miss America. So please welcome Jaylene Looper.
Hello, everybody. I am so glad to be able to join you all today and just share a little glimpse into what this topic means to me. Like Allison said, food insecurity is something that my family dealt with when we lost an income when I was a child. And for a few months, we didn't know what we were going to do. Sometimes we had to choose whether we were keeping the lights on or if we were going to have food on our table. So it was a harsh reality, especially for such a young age. And I do want to just dive into that a little bit more. Like I said, I was around 7 years old. I was in the second grade, and I had such a hard time focusing in school, as if focusing at 7 years old isn't hard enough. I just really couldn't sit still, and I started having behavioral issues, which was very unlike me, especially because I was such a good student. I also was very tired. My grades were suffering, and in addition to the low quality food options I had at home, I only really could rely on being able to eat during lunchtime at school and breakfast at school. Sorry, Onyx wanted to say hi too. But that was the main thing I was able to rely on, those school lunches. And that is part of the reason I'm so glad to be joining the AHA today and talking about what we can be doing at the legislative level, because if it were not for those free and reduced lunch programs, I wouldn't have eaten. And truly, that is an atrocity, especially when we think about Texas and we think about the communities that are impacted by food insecurity the most, which is rural and minority communities. And that's something that makes up a lot of Texas. So like I said, those are a few things that I dealt with, but the most amazing thing is now I am on the other side of that. And like Allison mentioned, with all of the things that I've been able to do in the last few years, it has allowed me to embrace my story to champion change for communities across North Texas. So just a few things I've been able to do are not volunteering for the North Texas Food Bank. I interned at the Hays County Food Bank that picture is actually when I reached 100 hours there. I was so excited. I partnered with the North Texas Food, or the Feeding Texas and the North Texas Food Bank, which what that really means is I am a partner advocate. So similar to with the HA, I will promote different policies that we can be writing our legislators, calling our legislators about. And then of course, I just volunteer at food distributions, at soup kitchens. If there's a fundraiser, the first one there, my church has gone volunteered with Minnie's Pantry, where we've distributed food to citizens in Dallas and all sorts of fun stuff. I met with Senator Jane Nelson's office. She was away in session, so that was one of her office mates. But everything that they are saying and they are talking about today, I have probably done it. I was actually really scared to talk about my own experiences up until high school. That's when I joined the poetry club at my school, and me and two other girls in my class wrote this poem about hunger, and it was called "You Know What Hunger Looks Like." We dispelled some of the myths surrounding it, and by the end of the poem, we actually all realized that we had all dealt with food insecurity at some point during our lives, and it just made that poem ring even more true, just talking about how this is not some obsolete issue that happens only to those who are homeless or are struggling, but it can happen to absolutely anyone. And that is what made me more confident in advocating for it, talking about it, and of course, volunteering for it. So I'm so glad that you all are a part of this mission that the AHA is on to make sure people have access to those healthy foods. And we have some really great ways that we are about to show you guys how to do that. So if you'll go to the next slide for me, Allison. Oh, I guess we're gonna answer questions first before we do that. So if any of you guys have questions for me in regards to my advocacy, or even just me being Miss Dallas and competing for Miss Texas / Miss America, I would be more than happy to answer them right now.
Good luck.
Thank you. I really appreciate it. Who said that, by the way? I didn't see your name.
Oh, sorry. It's Dr. Brittany Claiborne.
Thank you so much. I really appreciate it.
Absolutely.
Jaylene, I'm interested in hearing a little more about how you were working with Feeding Texas. Just for the group, actually, that bill I was speaking about last session that we worked on to help improve the process for seniors and disabled persons to get SNAP, that was actually spearheaded by Feeding Texas. So I'm curious what you were doing with them.
So I am just someone who helps amplify the message that they have. Whatever they do, I'm one of those people, especially because I love social media, that I'll get on and I'll tell everybody, this is what's happening right now. You need to go sign this, you need to go. And then of course, being Miss Dallas, I kind of have a different sphere of influence. And so I really am there to amplify that message and make sure that we are getting those out there, those advocacy letters out there, and that people are participating. A lot of times people think that young people don't like to support or different things like that. That's not true. A lot of times we just don't know where to start. So I'm really just one of those advocates who are getting people involved in that way. And also, if there are local programs that they're doing, let's say in North Texas, I am also one of the first people who is there with a sign in my hand.
So Jaylene, Andy is asking in the chat, how do you find time to do all these awesome activities?
It is a balancing act for sure, because I am also a student. I will be graduating actually next month from the University of Texas Permian Basin. I'm in their online program, but I have just had to learn how to really look at what my priorities are and juggle my several balls and just realize which ones are glass and which ones are rubber. So I love being able to do my Miss Dallas duties, but the really cool thing about it is I get to pick and choose how much I do or when I do it. So I just make sure not to overload my plate so that I can still handle my responsibilities of working and school and all of that fun stuff.
Okay, Elizabeth, I think we're ready for the next slide.
Well, I just wanted to add a quick comment. It will be so easy to cheer for you this summer in Miss Texas. You're just an impressive young lady, and we really appreciate you spending your evening with us and sharing your personal story. So thank you, Jaylene.
Thank you, Elizabeth. I really appreciate that.
Okay, so now we get to have some fun. And as I mentioned before, I thoroughly enjoyed getting text messages, and you guys, I can tell you started shopping over the weekend, and every day I would get a few more. So we were even adding pictures up until today. So we have 2 pages of photos. So we will take some time to kind of talk through these. I'm going to be honest, I looked at some of you guys, like what you had collected. I'm like, how did they get that for $10? I have to know the trick. So some of you guys must have very smart shopper skills that I'm interested in, but it was really fun to look at, okay, but if you want to buy something amazing like a pineapple, which we all know they're more expensive, then you're, potentially sacrificing maybe something else. So what fresh fruits and vegetables can you purchase in more quantity? Let's say if you were having to feed a family of 4. And some of you guys have shared your comments in your text messages, but I'm really interested to hear back from you guys what you learned from this field trip experience, and I will open that up to any comments.
I learned that I need to grow my own stuff. Okay, that's it. I'm done.
For sure.
And just to respond to that, I don't know if you all are on social media, but one thing I love about TikTok, I've learned to grow almost everything off of there.
I learned to grow them, but then quickly kill them. So that happens. Yama, are you still on with us?
I am.
Yama, I was so appreciative of what you shared with me. Would you mind sharing that with the group?
Oh, definitely. So as you can, so we're in the picture with holding the bag at the bottom left, and my daughter is with me, Taylor. She's 16 years old. So I told her what we were doing, what our mission was, and we talked about it. And what I thought was really interesting is that she's gone shopping with me before, of course, for years, but yesterday she realized that she really did not pay attention to how much food costs. So I told her, I said, well, we have $10. What would you like to get? And so she went to the items that she, was used to getting. And the first thing was grapes. And so she looked at the grapes and she was like, okay, I really want some grapes. And she was like, wait, that's too much. And at the end of the hour, just comparing, she elected to leave the grapes because the grapes were a smaller quantity than, even though the clementines were expensive as well. She said, well, I would have more food though with the oranges than with the grapes.
Yeah, and as a mom of 2 young adults that eat most of the food in our house quickly, and I'm pretty sure also don't realize the cost of food. I just appreciate what you said because, as they build their own homes and their own families, I think that teaching them kind of what those food items cost and what that looks like, and having to make those tough choices when you're on a budget, what that looks like. And so to think about families that have which we all have, budgets when we go to the grocery store, but thinking about families that are on extremely limited budgets and rely on those SNAP benefits to purchase their food items every week, and that those tough choices are those are being made at the cash register sometimes, and that's extremely difficult. So anyone else want to share about their experience?
Allison, this is Connie Kerr.
Hi, Connie.
Hi. It just pays to be a smart shopper. I mean, really, it is amazing the difference. I think I shared with you earlier that my husband went to an Albertsons yesterday, and I needed blueberries because I eat blueberries for breakfast every morning. And he came home with these 2 little skinny cartons of blueberries. And he said, these were $5 each. but I thought one was so small that wouldn't give you very many blueberries. And I'm like, why did you spend $10 on blueberries? I was appalled. So today when I went to Kroger, if you had a Kroger card, you got the blueberries for, let me see, $1.88 for a carton that was at least the size of the 2 that he had bought at Albertsons for $10. I got them for $1.88 because I had a Kroger card. This exercise was especially interesting to me because this is one of the few times I had actually been in a grocery store. I'm still using Instacart to deliver it to my front door because I spend less. It's not just a COVID thing. It's because I spend less, less impulse buying. So for me, the benefit is to be willing to make compromises when you're at the store. I would not have spent $10 on 2 little tiny cartons of blueberries yesterday. But my dear husband did, so whatever. But you just, and like you said, your daughter picked the clementines instead of the grapes. It's a balance act. And sadly, for a lot of families, that just means less fresh food. And that's a problem. It's a lot less expensive to buy a box of store label macaroni and cheese mix than it is to go into the produce section and buy tomatoes and grapes. So.
Thanks, Connie.
Uh-huh.
Anyone else?
Can I jump in? I want to echo what the other ladies have shared. This is Andy, and I so loved this experience because as a starving college student living in Washington, D.C., I have been that girl who has $10 left, and it's like, okay, what can I buy? Anybody wants any tips? I'm happy to share because I feel like I did a pretty good job, but I really enjoyed this experience because for one, I read it wrong and I thought it was $20. And so I got there and I had $10 worth of stuff and I was like, oh, this is so great, and I hit my $20 mark or whatever. But what was really cool is that I did take a look, and I'm glad that you guys worked with or partnered with Kroger on this because they have those great deals, those coupons and other things. And so one of the ladies was very helpful in helping me make sure that I had my Kroger card and the digital coupon. And, and I just was aware, right, of noticing that the sign hadn't been changed since the day before. And I said, well, can you give me a discount on these avocados? And, it's just having that wherewithal of saying, okay, there are some really great opportunities that you can, take advantage of. But feeling like you're kind of in a, you don't want to be felt like you're taking advantage. Right. And so like, I definitely understand that some of the insecurity that folks have, if they're like, I only have $10 and I can't get everything that I want, and so I think this was a really great experience for me personally, but I was excited to see how far I could make that $10 go. So thank you for letting us do this. I think it was a really fun experience.
Yeah. Any other thoughts?
I just have a quick thought. So I live in Ennis, Texas. I don't know if anybody knows where that is, but when we talk about deserts and kind of food shortages and stuff like that, I mean, we have a Walmart and an H-E-B here, so there is no Kroger. So for me to get to Kroger, I would have to drive at least 35 minutes just to get to the place where they're having those deals. Because like someone said, if I go right now to get a container of blueberries or strawberries or some other type of what we consider normal produce. My son, Micah, loves grapes. So right now I picked up some grapes the other day and it was like $8.
They're expensive.
They're ridiculous. I'm like, are they gold? What is happening? But anyway, so in places like this where we don't have access to places that give you deals like that, and because you don't have access, they can do whatever they want to do with the prices, because they're like, hey, you're gonna buy it because this is what we have. So, you know, I was even thinking about that part of, or that subsection of people that are in those rural areas, like Ms. Dallas was saying, that, you know, everybody doesn't have access to the cities where you do have a competitive edge in different supermarkets you can shop at. We have these, and for someone that is, you know, elderly or disabled, they can't drive that 35 minutes to go find a store that has the deals. They kind of have to get what they can get.
No, that's amazing feedback. And I think, as you know, as Alec and I work towards next legislative session and having conversations about increasing the number of grocery stores, and, you know, eliminating some of those food deserts, that's a really great talking point. That even where there may be, you know, limited or no stores, lawmakers could come back with this. Well, there is a grocery store within 10 miles, but there's one. And like you said, the price points are not going to be as affordable as they would be in an area where there are more options and can be more competitive pricing. So that's great information. Anyone else? Okay, well, hope you had fun shopping and enjoy all those fruits and vegetables this week. Whoever bought the pineapple, I really need you to teach me how to cut those up. Last time we tried that in our house, it was eventful. Next slide. Okay, so we're going to talk about the action we're going to teach you how to take today. So, can an email start a fire? Who thinks an email makes a difference? Anyone want to put in the chat, yes or no? Does an email make a difference? If a lawmaker gets an email from a constituent, what do you think they do with it? Does it sway their vote? Does it make them take notice? Any thoughts? Okay. If it's a good email, okay, Alec, well said. And we're going to teach you how to make a good email today. Okay, yes, it makes a difference. Emails help you to directly express your position on an issue with your elected official in a really quick way. Now, sometimes we use this tactic to just simply get on their radar screen, which you can imagine. It's April, session does not start until January of next year. We are doing a lot of relationship building. We are doing a lot of education. Emails are oftentimes where we start. They are also something we normally flood inboxes with during session, along with other tactics like phone calls and social media posts when we're trying to get a lawmaker's attention. But right now, they are a really ground softening tool that we like to use to open the door to bigger conversations. So the action we're going to ask you guys to take today, yes, it involves an email. But it really can open a door for Alec to be able to sit down with a lawmaker that maybe we need them to co-sponsor a piece of legislation we're going to work on. Or maybe we need them to send a question back to us or a concern back to us that we can research now, what our comments are going to be back to that when session starts. So it really helps us to have the best strategy possible for passing heart-healthy legislation during session. Personalizing your email, as Alec referenced, a well-written personalized email makes all the difference in the world. Many of you have taken action by sending an email in our system before, but we have something new we're going to show you today that requires a little bit of extra time, but it's so worth it, and it's going to help you personalize those emails. But please know, even when we send you the traditional email in our system, that final email that's in that box, you can edit anything you want. You can almost delete the whole thing and start over again if you feel really passionate about expressing all the words in your own. We're literally just giving you a template to start with. Next slide, please. Okay, are you ready to learn something new? Jaylene has already seen this because this is actually Jaylene taking action and testing this out in front of her computer. So thank you for doing that. But Elizabeth is going to switch screens for me. And we're going to walk you through what you're going to, following tonight's event, what you're going to receive in an email to take action on. And again, this is going to look similar but different from what you have received from us in the past. So I'll give Elizabeth a little bit of time to do that.
While she does that,
Yeah, go ahead.
my experience about writing the email, because I was able to already do that.
Yeah.
I made sure to insert my personal story because, like they mentioned earlier, telling your own story or maybe even sharing a friend, if you know one, is such a bigger impact than just saying, here's some statistics, this is why we want this to get done. So I made sure to list out, hey, I used to live in a really beautiful home, actually, but when my parents' income got split in half, we couldn't get out of our lease right away. It wasn't like an immediate solution. And while we were afraid to use those benefits such as SNAP and whatnot, there was other programs that really helped me and my sister, such as the school free and reduced lunch program. But now we have another opportunity to help people like my family, my former, my past tense family, be able to take care of themselves when they're in need. This dollar for dollar program would absolutely impact the way that people are able to utilize their SNAP benefits. And this is something that would mean a lot to me and mean a lot to all of those children out there, again, who may only be eating at school or maybe have limited options at home since grapes are so expensive right now, something like that. And so I just kind of detailed why this was important to me. And then I went and, like Allison said, tweaked a few things that I wanted and then pressed send. It was that simple. I think it took me all of maybe 10 minutes. So I'm super excited to see them walk you all through this process.
Elizabeth, here we go. Okay, so this is going to be the home screen you are going to see. Again, this looks a little different from where you start, but it gives you some basic information that we have talked about today. This action is going to be a targeted email at the House Agriculture and Livestock Committee. It is a committee that is going to be considering issues around SNAP benefits, increasing those double up bucks, is also addressing food deserts. But this is the right committee and where we want some of this education messaging to be focused right now. So moving on, the next few screens are going to look very similar. Now, keep in mind, Elizabeth has actually tested this for me, so her name was already on there. But this is going to be your first screen. And this is all pretty self-explanatory. Guys, please use the address. If you have a PO box, please put the address where you are a registered voter, because it will make sure that we have in our system and compare you when we need to with the elected official that is your personal elected official. PO boxes don't allow us to do that. So please put in your actual mailing address where you are a registered voter. Next, email address. We try really hard not to email you guys too much. But we will use your email to update you on this campaign and others from time to time. Your phone number. I'm going to point out at the bottom, that little checked box. If you guys can be sure you checked that box, here's why. We have to have that checked to be able to text message you about campaigns. We do this even less than we email you, I promise. But this is so important from time to time. Alec will text me from the Capitol and say, I just found out a bill is up for vote and it's happening at 8 o'clock in the morning. And it'll be about 3 o'clock in the afternoon. And I'm like, oh no, how are we going to get a hold of people and get them to take action so that lawmakers know before 8 o'clock in the morning? Sometimes it's even shorter notice than that. Lawmakers like to move bills around. We need your text information to be able to text you and get you to take action right from the convenience of your phone. But checking that tiny little box is the only way that you can opt in for us to be able to do that. So please consider, I understand if you don't want to get text messages from us, but if you will consider doing that, it will help us reach you quicker. Okay, so here's how this is different. The very first is kind of an open-ended box. You can type anything in here that is important to you about why this issue matters. This can be your personal story, like Jaylene said. It can be, if this issue impacted you when you were younger, if this issue is impacting you now, if you know a family in your community, if you want to tell them the story about, going to the grocery store and you realize the price of fresh fruits and vegetables and that's a hardship on Texas families. We need you to talk about why access to healthy food for all Texans is important to you. And you will see how this is inserted on the final screen, and you can make edits in a second time. But this is the only lengthy thing you have to type out. Some people may type a sentence. Some people may type a paragraph. Some people may type several paragraphs of a story. It's going to give you room to do all of that right here. Next. Okay, select the fact that's most impactful to you. We have multiple accurate facts here. You just select one of them, and having variety here makes sure that all the emails that are sent to lawmakers are a little bit different. And we want to ultimately share all of these facts with them, but this makes sure that there are not all the exact same emails going in. And then the final question, pick the option that best describes you. There may be more than one or two that describe you. Select the one that best describes you. Again, this is going to be inserted into your email. And then the final screen gives you your final email. And so you will notice, for example, the first paragraph, it does reference you were part of the American Heart Association Heart Spark event, and you learned about challenges facing Texans, and I am a parent. You can see where that parent fit in. So if you had said, I am a student, it's going to go there. And as you scroll down, this issue is important to me because, and you'll see that is one of the facts that Elizabeth selected. And then if you scroll down a little bit more, you're going to see some pre-made content where it says, hi, that is where your personal story would have been inserted. So you can see how there's some content we've planned for you, but there's enough variety in there that when lawmakers receive, let's hope they receive emails from all of you guys. So when they have all of those in their inbox, they're going to know they're all a little bit different. But you can delete anything you want in this. If there's something we have put in there that's pre-written that you want to get rid of and put some extra things that are important to you, feel free to go ahead and do that. And then you'll hit send email. So it does take a few more minutes to fill this out, but it will make all the difference in the world. And feedback from lawmakers has told us that they do not want to receive 20 or 40 or 50 or more sometimes of the exact same email. So this is a new strategy that we have access to and we're excited about. And we're almost testing it with you guys to see how you feel about it. So not only do I ask that you take action, but if you'll let me know if this was too difficult or if this was really easy, let me know how you felt about taking action with this method. Because I think we'll be doing more of this during session next year. Okay, Elizabeth, we can go back to this final few slides and we're almost done.
And I wanted to point out also, you'll see who you are emailing. Allison, did you want to touch on that real quick? Up here at the top.
Yes, please notice at the top, you will be emailing all 9 members of that ag committee. So don't let that concern you. So sometimes you're going to be emailing your personal lawmaker. In this case, we are targeting the members of that committee. So that's why you're emailing all 9 members with that message. Okay, and back to those final slides, and we'll all get to have our dinner delivered hopefully very soon. Okay, so you guys probably remember this from the last presentation, but there's always an action. But if we're going to ask you to do something, we're going to have something fun on the other side of it waiting for you. So next slide. So we have so enjoyed not only shopping for fun swag for you guys, but sending it to you. And so many of you have sent pictures or told me how you're using it. Okay, I'm personally excited about this next one because I've actually been using this amazing You're the Cure AHA tumbler for about a month now. I thought these things didn't actually work. This not only keeps coffee super hot, but it keeps ice super cold for hours. So this is a very reliable, awesome tumbler that we're excited to send to you guys. So if you will take action on that email in the next 48 hours, so in the next 2 days, and I will send the link to you when we hang up on this Zoom call. If you will send that email out, this will arrive in your mailbox soon. And with that, I think we are down to final questions. How's everybody feeling? Questions? Comments? Everybody's tired and ready to go eat? That's fine too. Okay, well, I'm gonna take it as a good thing because it means we were so thorough, we answered all of your questions. So with that, I'll move on to some pretty exciting news that Alec gets to share with you guys.
Thank you, Allison. Thank you, Jaylene. Thank you, everyone, for joining us today a little bit over time, and thank you for sticking with us. I hope you're all really excited and feeling prepared to go out and advocate for better nutrition policies and take the action that Allison just told you about. Before we close, I wanted to share some good news is that we are planning to hold our third and final Heart Spark event in person at the Urban Firehouse in North Richland Hills, Texas. We're still getting all the details together, so we'll be sure to share those with you by email, but we're really looking forward to getting a chance to meet all of you in person and connect finally in North Texas. So we hope to see you there in June. And with that, I think we can close out and you all can enjoy the rest of your evenings. Thank you for joining us. I think we have one more slide of our contact info here if anyone has any questions. Yes. Thank you, everyone.
Thank you. Thanks, everybody.